I'm 42, so I started getting my mammograms at 40 and had 2 completely normal mammograms, so 40, 41. I have 3 kids and a busy schedule, so I put a reminder on my phone to get my mammogram every year so that I don't forget. And so I called and made that appointment, and my mammogram, my screening mammogram was a year and a week after my last one. And I went in to get my mammogram done and thought absolutely nothing of it. Came home, and then later that day got the call that I needed to come back for further testing.
I work with her primary care pretty closely, so they gave me a call and said, you need to see Michelle tomorrow. And I said, okay. Here it's a breast diagnostic center. We'll do biopsy and tell them the diagnosis.
Even as a physician looking at it with the radiologist who did the biopsies, knew that it was most likely cancer. And it was a day or two later that I got the results that confirmed that it was an invasive ductal carcinoma. Because of its size, right now it's a stage 2A grade 3. The next step was to get connected with my team.
Every patient, I really look at them the same. So whether they're walking in highly educated or not, you literally have to take them as though they do not get it. Because the stress level for everyone is so high that most people, they really do absorb probably 30% of what is said. And that's why navigation is so important. I heard her, I got what she knew and what she didn't, and then we reviewed that.
We do believe in a whole body treatment, treat as a whole person, and part of it is, counseling services, nutrition goes into it, integrated services, integrated medicine, physical therapy. Our philosophy is we like to have a patient go through this process and come out as a whole.
There's even more support than I ever realized. I knew there was a lot, but there's more than I realized. And so I met with a dietitian who helped go over the research as far as healthy eating behaviors, many of which I knew, but she had some new things as well. And I've already started to implement those. And physical activity, exercise, helping to do activities to prevent lymphedema or swelling after surgery. So I'll be doing that. We talked about the importance of decreasing or managing stress. So just all of those healthy lifestyle behaviors. And for me, that's very empowering.
In general, there are 2 local treatments for breast cancer, and there are 2 systemic treatments that we sometimes use. Local treatments are surgery to remove the cancer, identify if it's spread, and then radiation, which is a local treatment. Systemic therapies include chemotherapy that treats every cell in the body, and anti-hormonal therapy. So her first decision to make is what type of surgery does she want? She was a candidate to remove just a portion of the breast. She really wants to be a little bit more aggressive as far as reducing any risk in the long term, and she's hoping to avoid radiation as well.
So initially I was leaning more towards a lumpectomy, but then I decided to have a bilateral mastectomy. For me, that was the better choice, but I realized that it's not the better choice for everyone. A lot of different factors play in. I have a 3-year-old and a 6-year-old and a 14-year-old, and looking at all of those different things, for me being 42, and for me the better choice was a bilateral mastectomy, but I don't want people to think that if they're in this situation that that's what they should do, because a lumpectomy is a wonderful choice too for many women who are in the same situation. And there are many different options for reconstruction, many involving implants.
In general, there's 3 options for reconstruction. You can do an implant type reconstruction. You can do a flap procedure where you're taking tissue from somewhere else in the body, typically muscle and skin, or you can do fat transfer where you're basically doing liposuction, purifying the fat cells and then placing those back into the breast tissue.
For me, after looking at my different options, I decided to go with autologous fat transfer.
Most plastic surgeons are pretty familiar with the technique. I think part of why a lot of surgeons don't necessarily choose it is because it's a very long journey. Breast cancer in and of itself is a long journey. Typically patients need 2 or 3 surgeries anyways. If you're doing fat transfer, you can only transfer so much fat each time. So typically, it takes 4 or 5 of those, albeit small surgeries, to get to a good result.
There is a whole team and they are here. Don't delay getting your mammogram because you're scared of what it might find. And yes, it is scary, especially if you get the call like mine. I did the, why me? I breastfed my kids, all these things. And then I did the, why not me? 1 in 8 women in the course of their lifetime will have breast cancer. And we know there are certain things we can do that lower our risk, or not having a family history lowers our risk, but still, there are many women who get breast cancer with no risk factors, with no symptoms, such as myself.